What is the biggest barrier inhibiting access to ASC in countries like Canada, and how can parents support that effort? Great question. It's a multi-layered question, actually. Uh, as many people know, about 75% of our patients come from outside our local area. They're flying in from California, Texas, et cetera. About 15 to 18% are actually international patients, including Canada, countries like Israel, a lot of different patients from around the world. The reason they fly here is because it's a technique that we've evolved here, obviously, for 12 years. And the most direct answer to that, and also trying to be politically correct, is that it's a technique that you need to have lots of training for in order to do. So if I was a pediatric metal rod surgeon, since about 2005 onward, that technique, if I was a pediatric surgeon doing scoliosis, doing metal rod surgery, that technique had evolved to the point by 2005 or so where we didn't have to go to the front anymore. Back in the 90s and earlier, we used to go to the front of the spine to release it and then go to the back and do the metal rods. The technique here in ASC and also back in those days is an open transthoracic, open transabdominal technique. The truth is, adult complex spine surgeons who do spinal cord injury, dural tears, dural leaks, nerve disc herniations, et cetera, probably have more training front and back by far, and probably would be very comfortable doing the technique that we developed, as opposed to a pediatric scoliosis surgeon that done nothing but metal rods for the last 15 years. And so the fellowship training programs have not been designed to teach that for the last 15 years. So it's really a big step in order for another surgeon to actually transition to this. It's going to be a younger effort in the years coming. How can parents support that effort? Well, I'm more than open to talk to surgeons from around the world. I've operated in 8 different countries. We have people visit us. That's dropped off a lot after COVID. But if you have a surgeon who wants to do a metal rod and you say, well, Dr. Antonacci does this technique, and he says, don't do that, we don't know what's going to happen, have them give us a call. I'd be happy to set up a Zoom and show them the data, go over it, and why it's a big step forward. Okay.